What's up, guys? The interview you're about to hear is, I had a great time. So the two folks that we interview on today's podcast are Dr. Shakha and Dr. Scott. Just a little background, but we get into a lot of it in the podcast. Dr. Shakha is the pediatrician for Coach Glassman's kids and has been for years. Also, they both had a significant role in CrossFit Health over the years, and largely some of the things we talk about in the podcast or how to take this idea or this concept of CrossFit Health and then figure out how to apply that moving forward. So we get it, and pretty sure that everybody's on board with the idea of CrossFit Health and trying to move towards the general population and fighting chronic disease. But the sense is that people are really struggling with how to execute that idea. And hopefully some of the things that we talk about in this podcast, because I really think they do, will kind of shine some or shed some light on some different ways to do that. It was such a good episode, and we talked about some things that are pretty in the weeds here with regard to chronic disease. So you're probably going to want to listen to this podcast 3 or 4 times and take some notes. There's some really, really good information. But we also talked after the podcast, and we are going to sit down and we are going to do a Q&A with both of them. We will put this out to the community beforehand. We will get all of your questions. Be as detailed as you want with those questions. We'll let you know when it's going to drop. But I really, really want to have them back on because these are some of the folks and these are the relationships that us as gym owners and coaches need to start fostering moving forward so that we can really start to battle that, tsunami of chronic disease, and we can do it with fitness, nutrition, and lifestyle. All right, guys, enjoy this episode. All right, everybody, welcome back to the Best Hour of Their Day podcast. I am super stoked for this one because what we're going to talk about today is hopefully going to fill in some gaps for the larger community going into the future. So guests on the podcast today are Dr. Shakha and Dr. Scott, a pediatrician and anesthesiologist. And what we're going to do is largely talk about chronic disease and how gyms can navigate kind of that new mission moving forward. But thank both of you so much for coming on the show. Super stoked about this conversation because I'm going to learn a lot.
Thanks for having us.
Absolutely. Yeah, thank you.
So real quick, just so people have a little bit of context, give a little bit of your backstory. So we were talking a little bit before we hit record, and I know, Shakha, you are Coach Glassman's, his kids. You're their pediatrician, correct?
Yes.
Okay.
Yes.
Great.
And I love it that you didn't say him. Everyone always says the adult. And I'm like, okay, I'm not that old.
Well, so I've learned some etiquette because I spent a significant amount of time in the hospital with my daughter. So I kind of know some of the rules with regard to that. So, yeah.
And and we live in San Diego. And so I met Greg and Maggie and family down in San Diego. And that's how I got involved with all of CrossFit. And really, I have been practicing here for 20 years as a pediatrician. And I was practicing kind of like I would expect most doctors to practice, where I was doing what I had been taught. I was always, I went to medical school at UCSD, and I kind of thought I was always doing like the best job ever. And then I started really kind of learning some of the stuff where, hey, why is this going on? What's going on? And I remember I went to one of our American Academy of Pediatrics, their conferences, the national conference. And I came back and I was like, why is Coca-Cola like front and center sponsor for pediatrics? Like, what do they have to offer us? I don't understand this. This just doesn't seem right. And it was about probably about 10 to 15 years into my career. And so I started asking a lot of questions about things that we were doing as pediatricians that didn't really make sense to me. Now, there's a lot we do that I think is amazing. But there were some things that weren't really making sense. And I started talking to Greg about this, and he helped me understand a lot of the politics and really kind of helped me get to the next level of bringing really health, not just medicine, to my patients.
Were you an oddball for having that question about Coke being a sponsor? Or is that something that like everybody's just like, oh yeah, they just a sponsor?
Oh, 100%. I mean, I went actually they had this huge, like a booth. They have these like vendor booths, and they had this huge booth. And so I haven't really told anyone this, but I mean, there were all these doctors lined up for free samples of Coke at a conference. Now, I will say in defense of all of this, I think we all change and we all get a little bit more educated. And there are probably things that I've done over the years that are ridiculous. So I don't want to be like pointing fingers at how dumb people are, but at the same time, ridiculous. So I remember I went up to the front and I went up to the salesperson. I'm like, excuse me, what are you offering us? Can I ask you, what are you educating us on here? And I remember like 2 colleagues pulled me aside. Like, they were embarrassed by me. They were like, Shakha, you're just embarrassing. I'm like, no, I just want to know, what are you offering me as a pediatrician, giving me a Coke sample at a pediatric conference? And so having said that, you know, for about 2 years now, they're no longer a lead sponsor. They're no longer sponsoring the AAP, the AAFP. But at the time, I was completely embarrassing to the docs there who were all lined up trying to get their free sample.
Everybody likes something free.
I would agree. However, I mean, that's just such a bizarre scenario. Like, it just doesn't make sense.
Yeah. And I think what's more bizarre is that, like, people are embarrassed by me going, hey, what are you offering? And they're like, look, I think you're kind of like harassing them.
but I think the interesting thing is the question that never gets asked, which, you know, because people are just happy. Hey, Coke's here, enjoy Coca-Cola. I mean, it's been ingrained in our life, our whole lives. Nobody says, what's Coke's actual interest in medicine? You know, which is the billion-dollar question probably. I mean, why do they actually feel the need to sponsor this? They're not just giving away Coke. If you see a sponsor, they're probably there for some gain.
And I think that is a disconnect for a lot of people in the community. And a lot of people think that Greg has just this hatred for Coca-Cola because it's Coca-Cola. And that's fundamentally not it. I mean, anybody who spent any amount of time with him knows that he, you know, like, he's a man of principle, right? He's just like, yes, hey, listen, this is what I believe. And this is what's right and wrong. And he actually doesn't care if people drink Coke. He's like, drink all the Coke you want. He's like, don't fool yourself and think that it's healthy. His beef is their interference in health sciences.
Yeah, that's 100% right.
Exactly.
I've heard him say it, you know, multiple times, that he wants Coke out of the medical industry. You know, not that he has any problem with the business. He's very libertarian, so he doesn't care. I mean, each person can do whatever they want, but he doesn't want the behind the scenes influence of the healthcare policies by a soda company.
And you have such a great point, which is, were other people wondering why they were there? And no, they weren't. They were just, I mean, passively just taking what was being given, or not even passively. They're standing there waiting for their free sample. So doctors should have been asking.
It's like good looking drug rep. I'll prescribe this drug, you know? I mean, free Coca-Cola. I mean, people don't, you know, I mean, doctors don't get out much. So if we get a little bit of attention, we're easily, you know, falling prey to some deceptive marketing techniques.
And so, and we'll get into this a little bit later in the podcast, but what are some of the things as a pediatrician specifically that so like, I think regardless of what profession you're in, I can think of some pretty awful things I've done as a trainer 10 years ago, 11 years ago. From a pediatrician, what are some of the things that you've kind of reversed course on with regard to treatment of your patients? Which is incredibly important, because your patients are a future generation that are either going to need massive amounts of healthcare or not, essentially.
Yeah, no, I think the big one is diet related. So food related. I definitely, when I first came out of training and for a good 10 years, basically prescribed and just repeated what I had learned. And I really thought that's what we did. And so, for example, first food was cereal. And then the whole like, oh, well, as long as the cereal that kids are eating are multigrain, and that whole just feeding processed garbage and not really recognizing that I had a great voice to help families understand that that's not what we feed our kids. So that's a big, and like I said, I don't want to really call it a mistake. It's more of a learning, because what we're doing is we're doing what everyone's doing. And I really had to get past, and that's what Greg really helped me with learning, is to really kind of open my eyes. And he gave me the support for, I was already opening my eyes with that, but you know what? It's okay to do that. There's something for me that's asking that, and it's a good question I'm asking. So it's the food. And then also treating things with medicines where they should be treated with food. So if a kid comes in with, and I've said it before too, with like constipation, instead of just giving a prescription for a medicine, I really need to be asking people, and people need to be asking themselves, what are you eating? So, I mean, that's not the same thing for if you have pneumonia, I'm not going to have you come off gluten, right? So there is a great place for certain medicines. But at the same time, I can't sit around and have these kids eating all this junk. The other thing is it's given me a backbone behind it. So when I'm sitting there and patients are right in front of me popping, or their kids are eating granola bars and fruit snacks, I actually have so much more strength. I feel like I have an entire army of doctors and the entire team who are supporting me saying, yeah, you know what, you got to drop that. Like, that is not a food. You can't give your kids this food. And it's just that's what's better about this.
And I think that starting in the early 90s, this whole idea of evidence-based medicine came about. And, the words sound pretty sexy because you think everything you're doing is based on, some real science, and you can feel good about what you're doing. But, and this is one of the things that Greg has really pushed as far as the physician side of CrossFit Health, which doesn't really deal with the affiliates, but with educating the physicians who are CrossFitters. And that's about how most science now is really what's called consensus science, which is a bunch of people get in a room together and go, well, what do you think is best? Well, what do you think is best? Well, I really like that Coca-Cola, and that rep was pretty cute. So let's use this medicine. And, so the way that decisions are made based on consensus is not really what's called modern science. It's called postmodern science, and it's not really actually scientific techniques. So a lot of but then doctors just follow along. Oh, this is what the guidelines recommend, but nobody really, digs into the story. Well, how did these guidelines come to be? Because physicians are really busy. You can put like a bunch of garble in the body of a paper, and the doctors are just going to read the abstract because it's
the title
or the title and say, oh, this is good, and then it gets diluted out or diverted even further when it makes the headlines for MSN or the latest news channel or something. So people don't really have science behind the recommendations that are being made.
There was some really interesting talks, and I'm really bummed I missed the vast majority of them at the health conference at the games. But Greg talked about that at the affiliate gathering too, about how that postmodern science, which is largely consensus, or you can think of it as like this kind of like weird self-licking ice cream cone of peer review papers, right?
Right.
Yeah. He talked about that, and he said it's the antithesis of actual science. It's just like we all agree because that's what we think it should be, versus it doesn't seem like there's as many kind of naysayers or that one person in the group who's there simply to oppose the idea for the sake of having a discussion about it.
Right.
He talked about that at length. And
if you disagree with the consensus, you get kicked out of the club. So it's a very, very, it's very adversarial to having, differing opinions, which is, how most things really come. The answer almost always lies somewhere in the middle, and it's only through intensive debate and disagreement among scientists that you kind of get down to the truth, I think. And that's really been bred out of the current medical system.
Do either of you think that is because largely many of the things that would fall in that chronic disease bucket don't necessarily feed the medical machine from a financial standpoint?
Oh, for sure. I mean, there's not a lot of money in eating real food, whole food. The food industry is involved in that because, they want you to eat packaged food. And, similarly, people don't want you to eat meats and vegetables, nuts and seeds, go do CrossFit 4 or 5 days a week and get healthy. They want to put you on a medicine. And the medical system and doctors do a lot of amazing things, and all healthcare workers, from first responders, nurses, people who sweep the floor in the hospital, everybody in the medical industry works really, really hard, long hours and makes a lot of sacrifice. And most doctors aren't these, conniving, malicious people who are looking to screw you over to get rich, So I think people don't realize it, but the system is really designed to put you on medication, and medication only, other than like acute illnesses like an infection and maybe some medicines, acute medicines, you could almost say cancer is like an acute illness that you can defeat it. But a lot of other things, the medicines are designed to just slow the decay, the descent, before you crash into the ground and get buried. They don't really reverse the course of disease.
Except anesthesia, which we love.
Right.
For sure. I don't think people want to be awake from most of those procedures.
But in certain, that's when, like a lot of people go into anesthesia and stuff. There's certain subset of doctors who just love surgery because when you cut something, you can often cure. To cut is to cure is kind of the surgeon's motto. But when you go to a lot of primary care people, and it's not their fault, and this is where really the role of CrossFit Health and the affiliates come in, is that the system is not set up to see you for 1 hour, 5 days a week, and to help you move and to give you just little snippets of information on the whiteboard, like a little talk on some days about nutrition, a little talk about, self-care. Are you doing things? Are you happy? Are you getting enough sleep? All those little things. I can try and throw all that into your 5-minute appointment by going, and make sure you do, like the disclaimer at the end of a drug ad for all the things it might do to you. But a physician can't really, nobody hears things one time and goes out and knows what to do and does them. It takes repetitive kind of, reminding and instruction. And it's just like any of the benchmark workouts in CrossFit. Not too many people, unless they have an incredible fitness background, come in and just nail them all. It's you make progress and you continue to make progress and you make changes and stuff, and people work with you on a process. And getting healthy is the same way. So
largely anybody's going to be listening to this podcast, like everybody agrees, right? So there's not going to be a ton of people that are like, no, this is a bad idea. So I kind of have a question with regard to some of the patients that you see, probably more so. Most of yours are knocked out, Scott, and don't talk to you, but Shakha, for you, how do you start to have that conversation? So, and I ask that because largely the kind of docs that fall into kind of this more holistic method, they get gobbled up pretty quickly by a lot of the people who want that type of treatment. So are most of your clients pretty health conscious, or are you still dealing with a fairly large population of people who just don't know any better? And if so, how do you start to have that conversation?
Well, I think that people are actually open to at least hear it. They're open to hear so it's not hard to have the conversation. Mm-hmm. What's limiting on it is time for me. I know when I'm sitting there and let's say I'm talking to somebody about, let's say it's a kid who probably has pneumonia and the other two kids are in the background eating, a Slurpee. And so I really want to go, hey, you can't be, that's not good for you. The sugar there isn't good for you, but it's how much time I have. So one of the biggest it's not that they're not open to it. And then the second part is that how much of it are they actually understanding makes that difference. And that's where it becomes more of the lifestyle and how do they have it happen. So I can tell them, you got to cut out the sugar sweetened beverages. Mm-hmm. It's this, and I can have a conversation with them. But then if they're in there, let's say I have a 14-year-old with headaches, mm-hmm. and I'm talking to them about headaches and I say, well, what are you eating? And then they get that. And then at the end of it, they're like, what do we do for the headaches?
Got it.
And so like, no, I just told you what to do for the headaches. So they're open to it, but number one, understanding the significance of what that is for everyday health. And then number two is just time. And number three is actually, I think it's a lot of what people really want. And so that's where I think that the bulk of this, I'm not going to be honest, I'm not going to make the difference. Making the big change is not going to be from the doctors. It's going to be from the affiliates, from the coaches. They're the ones that are going to conquer chronic disease. It's going to be them. And the reason why is I can only say so much. The time is, like Scott said, the time is going to be spent with them educating. Right. And it's sort of the foot soldier versus a general. A general can kind of lay out a master plan and come up with some plans of action for you. But,
you need troops on the ground that are going to actually do the actual work and be there on a consistent basis, day in, day out. And that's, you're not going to go to your doctor for an hour a day, every day.
So from a practical standpoint, what would you guys, and I'm asking you personally, and a lot of people get a lot of value out of this, how do affiliates, because there's two conversations in a lot of scenarios that we have to have. One, we have to have that conversation, which most of us at this point are probably at least somewhat well-versed, depending on how long you've been doing this, about starting to have the conversation about you need to stop eating refined carbohydrates and start eating whole foods. That conversation is not as difficult anymore, just based on a lot of things. Most people are walking into the gym and they're there because they haven't figured it out. The far more difficult conversation I've found in the more recent years is having conversations with the medical professional behind that person who said they need to go do some things, but they're also said, yeah, and you need to be on statins and all of this other stuff. And I talked about this with Greg on the podcast we did with him, you know, that we can't cross that line. Like, that's irresponsible and negligent in a whole lot of ways. So how do we start to have that conversation kind of potentially through our members to the doctor or directly to their primary care physician?
Yeah, that's a great question. And I mean, maybe one of the ways is to give some primary care physicians in your community free membership or something, you know, and actually bring them on board and slowly indoctrinate them into sort of the mess and into having, you know, a new way of thinking. Because most physicians, you know, I mean, even in, you know, in our professions, and we've been involved with CrossFit for a long time. I mean, you say the word CrossFit and people are like, oh, you're going to get hurt, or, you know, that people really still don't outside until you come in and see it and do it for yourself. It's really hard to just tell people those things. And so the best way is to try to find people who, you know, maybe look for, and CrossFit Corporate is slowly putting together a directory of physicians who are CrossFitters or CrossFit friendly, so that people can maybe direct their medical care to those people.
Can I?
Yeah, go ahead.
No, you.
I was going to ask, is there something, if I was trying to get to one of you two, we've already established that both of you guys are crazy busy. So that's already hard to even get on the radar, much less get some time. So are there ways, are there different avenues I can approach from that would at least allow me to start that conversation? Because I've probably tried to call no less than a dozen doctors who were either ortho surgeons to determine like what was wrong with, like, how did surgery go, what's protocol moving forward, or primary care physicians who put people on a ridiculous amount of medications just to get some background information about what this person can and should be doing moving forward and what we can potentially start helping them do with regard to their health and their wellness. And I'm batting zero at this point. So the only ones that I have a direct line to are the ones that are already in my box. Like, they're like, I get it. I totally understand what you're doing. Like, I'm in.
But I think that's a key too. And I think in every box, there's, you know, at least 3 to 5, probably more and more physicians. And I think that, you know, I think everyone's heard about all these MDL1s that are happening, you know, with a certain frequency, and going up to Santa Cruz, these doctors are all doing the L1, and they're doing it together. And it's really with a mindset. And then they're coming back afterwards to the following ones, you know, that you guys know, that's the DDC, and building an army of physicians, and we're just getting bigger and bigger and stronger and stronger. I think they're already out there, but then to really kind of reach out to them to let them know. So what is being done in the background to be able to have this is more and more of the docs are getting their MDL1. And so they
for those people that don't know what the DDC is, can you elaborate on that? Because I think most people are on board with, like, okay, there's a level 1 that's primarily for, you know, doctors, nurses, stuff like that. But what is the DDC for those?
So the Derelict Doctors Club is it's at the same time as the MDL1s in a separate part of at HQ, and they have 3 speakers, 2, 3, 4 speakers who speak about different aspects of the mess, whether it be, you know, Dr. Jason Fung, or who's speaking about, with the diabetes code, obesity code, also speaking about how monies are moved around in medicine and what the dollar values and why things sometimes don't make sense. So those lectures are happening at that time and continuing. So people who have done the MDL1, they will go back and will gather together during that time and continue to basically have like-minded physicians, some affiliates who are discussing basically the mess.
And a lot of the, if you follow the articles and the little videos that are on the main site, most of the ones that involve different speakers are talks that were either given at the CrossFit Health Conference or at the DDC. So it's basically a similar group of people. They're not really like, this is how you treat diabetes. They would talk about, this is how the system's broken and what's wrong with the protocols, or, where there's some sort of break in the system between what should be happening and what's actually happening.
And then that's for the physicians, right? That's educating the doctors. And we're getting more and more. And then, anyone that's near us will ask us and we'll refer out. There is the physician network that will be, happening so that people can reach out to them. But then for the affiliates, it's like Scott said, those videos are up. And I know sometimes it's hard, sometimes you go on, but the main site has so much great information. And I think it's just a matter of diving in and don't be intimidated. Some of the articles seem a little difficult to read sometimes, but the summaries are amazing. And then you can go in and just start. And once you start reading them, they really start making sense. And even if they don't completely make sense today, keep reading them, they will. And you're going to have an aha moment. The affiliates are going to go, oh my goodness, this is exactly that. And they're just educated with that information.
And I'm glad you brought that up, because that's something Greg also talked about at the affiliate gathering. They've kind of switched the purpose for main site, which is, it used to be that B2C tool, which is like people that want to do CrossFit and people that want to do seminars, they go there and to be entertained and watch videos, and they switched it now as a B2B tool. But I don't think most people know that, because quite frankly, I didn't know that. But when he said it, it made perfect sense. And I talked about this on a previous podcast, but the website now, at least to me, this is my opinion, very much when I read through those articles, that's what I envisioned like CrossFit Health being, right? So it's all these articles that will allow affiliate owners, coaches, trainers to start having an educated conversation, so that when they do have the opportunity to sit down with a doctor, the doctor's like, oh, you are well read, and not just somebody who just wants to have an argument with me about like this person and their statins. So that's where I think that tool is underutilized, simply because people don't know why it's there and they don't know how it would be valuable to them moving forward.
And it just gives them a better understanding of what's happening in the entire space. Because again, to me, the affiliate is who's going to make things better. They're the ones who are going to conquer this chronic disease, prevention, reversal. But if they don't know enough about diabetes, and not enough to they're not med managing, but they're understanding the disease concept, right? They're understanding why why they're not eating sugar, which is, and I know we all know that the refined grains, the sugar, I know we all know that, but at the same time, we need to be role models on that and sort of understand that that's what we need to be helping our clients understand.
And I think too, most people have come to really believe when you go to the doctor and they give you a diagnosis, that now this becomes your identity. Oh yeah, I'm a diabetic, hypertensive, obese person. And society has become very much, people have become disempowered and they're sort of a little bit of a victim. And the reality is that people need to be more accountable for their health and well-being, but also, empowered to know that that the solution is within their hands. And that's one of the beautiful things about CrossFit, and this is what Greg talks about, it is the life raft and the tsunami of chronic disease, that that chronic diseases are all preventable and reversible. And, almost every single chronic disease can be reversed with proper diet and nutrition.
I want to make a comment on the main site too. It's so as an affiliate, you're not going to give medical advice. You're
Correct.
not going to.
Yeah, I do want to stress that. Like, do not cross that line. That is not.
And I wasn't even. That was just coming from me. You're also not going to probably sit down with your client's doctor, but you are going to be educated going through these main site articles on why the treatment or the reversal or the treatment is going to be at your box, and how you as the affiliate are going to make them better. And the idea that they probably don't need to be on a statin, and they're going to be better with the work that you're doing. You're not prescribing it. You're not unprescribing it. You're not getting on the phone with the doctor, but you're making that your client healthier. And the science behind it. And so even though, again, like the thing for me is, I know some of the articles are hard to read. I know they are, but they're really well summarized. And then pretty soon you'll start going into the articles, people will, and really reading them. And they're actually fantastic.
Yes. Where I have found success is not necessarily direct to a physician, but essentially arming my client, who is their patient, with information to either ask a question or propose a solution, right? So like, for instance, I had a guy years ago who he was a little bit overweight. He wasn't super overweight, but he got his blood work back, and he knew I was a CrossFit trainer and owned an affiliate, and I was still in the military at this point. And the docs were going to put him on a bunch of medications because they saw his, he had triglycerides of like 400. I mean, it was high. So I said, hey, like, listen, I'm not going to go against the doc. And I actually knew the docs, but I wasn't going to have that conversation. I said, ask them if they'll give you 90 days.
Bingo.
Before they put you on medication, so that we can try to do it with food. And I mean, we brought him down like under 100 within 90 days, like just by
amazing
eating. But the doc, and that's where my recommendation would be, is like, arm the patient with the information, because the doctor will have the conversation with the patient. They will not have it with a third party.
Yes.
Right.
But it's great that you knew 90 days you're going to do it. And you were comfortable with that. You were comfortable with that. And you did exactly what you should do, is where you talked to your client and then you did the work that needed to be done. There's been a lot of articles on non-alcoholic fatty liver disease. And some of the articles have been, if you look at the articles, it shows you how quickly it can be reversed. And so you're not doing the prescribing, you're not doing the unprescribing, but you're able to have that information as to what you're able to do with your programming.
Right. And it can be reversed within 2 weeks, which is incredible.
Yeah.
I mean,
9 days.
That you can reverse something that is now the leading cause of liver transplant in this country. And just with changing your diet and exercising, you can change the course of that chronic illness like almost overnight.
I think this is why a lot of the allergy testing and a lot of that stuff has become pretty prevalent, at least within the everybody's getting blood panels done these days. But Mike G had actually, he recommended that I bring up some of the chronic disease testing, and then like how affiliates and coaches can educate themselves more on that. What's important, what's not important, what should they start to be digging into? From a physician standpoint, like, what would be step one for an affiliate with regard to some of that stuff?
All right. So, it's interesting because Shakha and I actually started a company because of this very problem. And the fact that when you go to your doctor, you're probably not going to get the test ordered that you want. And then even if you do get them ordered and they don't come back the right way, they're going to put you on, metformin, insulin, a statin, a blood pressure medicine. And instead of, giving you that, the 90-day test, as we'll call it now, where you just change things and say, let me come back in 90 days. So we started a company called the Warrior Clinic where, there's a lot of different things you can screen for with chronic disease, but the most prevalent and debilitating things in this country are due to sort of what's called the diabesity, epidemic, which is diabetes and obesity. So we have a test, a very basic test that screens for hemoglobin A1C, and then lipid panel, but it focuses on triglycerides and HDL, not the LDL. You get that result, but we're not looking to put people on statins. and we provide instructions for people with, what kind of lifestyle changes to make if their labs are not normal. So it's a simple at-home kit that you do. You can order the kit, you get a check, and then, I sort of liken it to, you want to check the oil in your car from time to time. There's no way to really know, I guess you have a check engine light, but you don't want to wait for that to go off. So you want to do these tests to see how you're doing on the inside.
So this is why I think this is important, because, and I want you to elaborate on the HDL for people here in just a second, but I think the reason why services like that are important is because I cannot tell you the number of times that I've had pushback from a physician, and largely this was in the military, when I was trying to be proactive about blood work. And the counter argument was always like, well, it's an invasive procedure. And I'm like, everything in the military is invasive. I'm like, what are we talking about right now? But, I would ask I'm like, hey, can you do a fasting insulin test instead of a fasting glucose test? I would just prefer it. And I would literally have to lie and tell them I had a history of diabetes in my family in order to to get some of that stuff, because those were the only ways I was able to have a conversation with a doctor or somebody who wanted to put me on cholesterol meds because I had cholesterol of 230, and I was like, it's the only metric of every metric that you pulled off of me that's off. Is it possible that that's not really a big deal?
Yeah, you've nailed it. You nailed it. And the tests, two things. One is the tests that we picked are just the ones that we really think you need, and they're the most valuable. You didn't mention that you can add. So those are the two biggest ones.
Okay.
And that's what's included. You can add on a HSCRP, and you can also do. So that's the only test we have, and then you can do a fasting insulin.
Okay. We
wanted to make it to this is the big money right there. That's where it's at, and it's affordable too. So you're not going to go do a $400 test. The one thing that you mentioned about the pushback is, so we even get pushback, and there's some docs that'll say, you really need to leave that to the physician. The physician needs to make the decision as to whether a patient gets this lab or not. Mm-hmm. And I really have that makes no sense to me. So if you look at, it makes no sense to me. Why?
But the bottom line is that, a lot of doctors are, how they order tests is very protocol driven.
Yeah.
But then you look around and the incident, and if people are getting healthier and better, you'd say, oh, that's great, everything's working. But the fact of the matter is people are getting more and more sick. The incidence of chronic disease is rising, and 70% of deaths in the U.S. every year are due to chronic disease. They're preventable and reversible, but there's no reason, with all the science and technology and everything we have, that people should be getting sicker and sicker. And I don't think most people realize how much bad food they put in their body, even people who think they're being healthy. And that's why it's important to screen and check, because we all think we're doing pretty good, but we eat a few of these packaged bars, they say they're paleo and they're, organic and they're gluten-free and, made on Mars. Whatever the labels are, some crazy stuff that, this is the latest thing. But in reality, most of that stuff is not healthy. If you're not eating just real food and whole food, it's probably not healthy. And unless you check, there's no real way to know.
And it's a lot of the blood panels and some of these things are, in my experience, the people that pair the nutrition with the fitness with these additional metrics are the ones that have the most success, because you can lie to me about your food, you can lie to me about your training, but you cannot lie about that blood test, right? When it comes back and nothing's changed or it's gone in the wrong direction, and I'm like, we have to acknowledge that you're completely full of shit at this point. That's not how this works, because like you already said before that, a lot of these things, 90 days is a big enough window for most of these things to see a fairly dramatic swing in one direction or the other if we're putting in the effort.
Oh, yeah.
Oh, absolutely. Yeah. And I don't know if you've heard of the company Verta. It was started by, what was his name? Sammy, the guy who did the, he did was it Apartments Online, or I forget what he did. He did some internet. Trulio.
Okay, got it.
He was an interesting person because he decided he wanted to row to Hawaii with his wife. And he's like, hey, honey, what do you think about this? and they were both endurance athletes before, but he went around and asked, what was the best nutritional program for that. And eventually he ran into Steve Finney and Jeff Volek, who have done a lot of work with like low carbohydrate nutrition, and decided that was the best way for them to do things. But when he got back, they actually broke the record by about 15 days for rowing to Hawaii. But when they got back, he started this company where they work with type 2 diabetics, and it's sort of a online, conferencing, and then they test people. But they've had people on these low carbohydrate diets for extended period of times and had tremendous results reversing disease. But they had this one small subset of people who didn't get better. And so he did, for a lot of people, they do these food labs where you have to be locked up in a place. But he did a ghetto food lab. He took everybody to a Holiday Inn, and nobody could leave. And they controlled every single meal that all these people had for several days, and every single person that was a non-responder responded.
Weird.
So
weird.
Yeah, weird thing, right? So because there's all this stuff, and you have these non-responders, et cetera, et cetera. Probably it's non-compliance. Almost everybody, if you eat the right food, to respond.
It's super funny that when I give the nutrition lecture at the seminars, I kind of, because I've been doing this for 10 years at this point, like I kind of tell that story in the gym, which is, okay, so somebody's doing constantly very functional movements executed high intensity. They start to see a little bit of body composition change. They start to get a little bit fitter, and then they plateau. And then we have the conversation about their nutrition. And I say, how's your nutrition? To which the response is unanimously 100% all the time, it's pretty good. I'm like, okay, what does that mean? And come to find out, they have no idea what it means. They just are embarrassed about what's going on. So that is just the natural response. And even when they do start to comply to some degree, it is a safe bet that 100% of your clients lie to you with regard to like what they're eating.
So there's some I agree. There's something else too that, I don't really want to be 100% compliant to perfect eating. Sometimes I want to have a little fun, and I want to have, whatever it is. And there's something I want. And so the whole thing with the testing is, we know that a third of our country is pre-diabetic, that between the pre-diabetics and diabetics, it's about half of our country. And so what we want to do is find the right balance. And we also know that no one specific nutrition plan is perfect for everybody. We all have different metabolisms. And so for me, what I want to do is I want to check, on the regular to make sure that, once a year, to make sure that what I'm doing is working for me. And that's for somebody like me. But for someone, if you're an affiliate and you have a new client, what you want to do is get a baseline. And then, or even if it's not a new client, if they haven't had testing done, get a baseline, see where they're at, and see, what they are having, what is their carb intake, and then if these labs are high, make the changes that you can make and retest them in 3 months to find what their bodies and their metabolism needs to do to keep them from losing their vision or other, being dizzy and waiting for those symptoms, then going to the doctor and then being on meds. Like that basically like summarizes what I want for the testing, right?
Right.
I would agree. So let's do a super mini workshop here. So for the test that you guys recommend with the Warrior Clinic, obviously you guys are going to make the recommendations there on what needs to happen or do a consult. Well, actually, how does that work? Actually, let's back up a second. How does that work?
I'll tell you, for everyone, you go online, you order the Warrior Kit. Okay, you go on www.thewarriorclinic.com. You order it, comes to your house, you poke your finger. If you can't poke your finger, someone can do it for you. If you can't do either of that, you can actually choose to go to a lab as an option, but it's really easy. You stick it back in your mailbox, just put it in the mail, and then we get the results. We get the testing, we run the test, and you get it on your account, and you get like a really pretty color-coded green, yellow, red with then a discussion. And all of the discussions start with, don't panic, this is reversible. It's we don't want you to run to your doctor and get on meds. Yeah. We want you to, and if you're all green, great, carry on. If you're yellow, what you were going to say something. And that's the way. And then if you're yellow, we want you to make the changes with your coach, with your box, not we really don't want you at the doctor's office. We want you doing the things, we want you with the people that know how to make a difference, that make the.
Yeah. So on that note, so for any trainers or coaches who are listening to this and they kind of want a crash course on just to be educated, not necessarily to make a recommendation of any type, what are some of the metrics that would, and as broad as you guys want to make it, as far as like what puts me as far as A1C or HDL or anything like that, excuse me, what do those numbers look like? Or what would you guys see, or what falls in the category of red where a patient, where this is like alarming?
Yeah.
Well, so I'll start with just a little background on, diabetes, which also is, there's a Joseph Kraft did a ton of these tests where he tested both insulin and glucose together between fasting and then after a glucose challenge test. And Joe Westerland is obsessed with Kraft and the Kraft test.
He's a smart dude too.
Oh, he's super smart. But the thing that was discovered is that elevated insulin levels, precede elevated sugars, and even elevated sugars in the low levels for a long time. And they're really the root cause of a lot of chronic disease. I mean, some people would say they're at the root of, diabetes for sure. Heart disease, cancer, Alzheimer's, polycystic ovary disease, obesity. I mean, the list is very long. And that's all basically due to consumption of refined carbohydrates and sugar, which unless you're really strict and you're reading every label, it's in everything. Mm-hmm. And so I think that's a great place for the trainers to, it's not long lectures, but periodically in your talks at the whiteboard, talk about, are you introducing more whole foods? How much food are you eating out of a package? Those type of things are very useful for them. And then when your results come back, the exact numbers are on the website, so I don't want to spit them out because I'll probably say the wrong thing. But, and unless your number's alarmingly high, it's not like you're in this emergency state. And by just making the lifestyle changes, you can see the changes in a pretty short order and then retest.
The diagnosis is really an A1C over 6.5, puts you in the diabetic range. And then pre-diabetic is 5.7 to 6.5.
Yep.
And then less than 5.7 is considered normal.
Yeah. And that's where I think some people get lost is like, okay, what do I do with this number? But I also wanted you to, can you give a crash course on the HDLs and as far as like what you think most people should know, just like very baseline level. You don't have to go super crazy on this, but okay. This was largely one. Do
you have another hour?
I do. I don't know how everybody's going to listen to it. I would love to listen to it. But I think that's one that gets misinterpreted a lot. That's why I asked the question.
We'll give a summary and then the details too.
So to deal with cholesterol and fat, fat is a storage form of energy on our body. It's there for a reason, and fat is not a bad thing. In fact, like the fat that's like the, outside of your abdominal wall, that type of fat is considered to be healthy fat and is not really associated with chronic disease. It's the fat that accumulates in your organs and especially in your liver that leads to, the bad things that happen with health.
Yeah. So for anybody who's like, I'll back up. So that would be what he's talking about. What Scott's talking about is the visceral fat is what's bad. That kind of subcutaneous fat is not as indicative of chronic disease in most cases. And Jason Fung talks about that at length in his book as well.
Yeah. And that, our body used to put, back in the days, we didn't have, Whole Foods delivery through Amazon. People would not have food for periods of time. And so they would eat and store fat, and then they would have to go forage or find the herd again to get more food. So we're designed to do, this whole intermittent fasting thing is probably how we lived a long time ago, just because we didn't have food around all the time. But HDL and what the doctors treat with statins, LDL, are not actually fat or cholesterol. They're actually the carrier vessels that carry and shuttle fats around the body, because fats are not soluble in blood. Blood's basically water-based, and so fat would be just like oil droplets floating in your blood. So they're these little protein-encased molecules that have a water-soluble casing on the outside and fat-soluble on the inside, and they carry they transport the fat around the body. And characteristically, LDL has been called the bad fat and HDL is called the good fat. But the reality is that they're all good in the right proportions. They're all, cholesterol is made by almost every cell in our body, and fat's an energy source for our body. So all these things are not like, it's not like black and white, like good and bad, but excesses of some things are bad. So HDL is considered to be the transport vessel which carries fat from the periphery back to the liver to be metabolized and gotten rid of. So it's called, and that's why it's called the good cholesterol. And a lipidologist will tell you, well, it's much more complicated than that. But the bottom line is that higher HDL levels found naturally, they tried to elevate HDL with medications and people actually had worse outcomes, but elevated HDL from natural causes, from exercises, not smoking, not eating refined carbohydrates and sugar, are highly correlated with good health, low incidence of, they're correlated with lower insulin levels and also with lower incidence of cardiovascular disease.
Cool. So now you guys know about HDLs. So no, because I do think that it's something where a lot of people look at some of that stuff and they're not really sure how to interpret it, or they're just like, okay, what do I do now? But I do think it's something, it doesn't take you very long to get like a baseline level of knowledge on some of this stuff, like, which I think is good to be armed with from a coaching standpoint. So anything, or what else would you guys recommend from a testing standpoint? Like, is there anything past those original 3 or 2?
Well, yeah, along with the HDLs, the triglycerides, and the ratio of the two, you really want it to be less than 2-to-1 triglycerides to HDL, and lower is even better than that. But other things that we looked at to include, we have HSCRP, which is a reactive protein which is made by the liver in response to inflammation. Inflammation is sort of the mechanism by which chronic diseases occur. Something inflames, almost like rusting on the inside of your body. And so we added that test, which if it's elevated, if it's super elevated, it's like because you got pus coming out of your arm, or you've got some type of acute inflammatory process going on, and then your CRP is going to be super high, and that's the way it's supposed to be. It's all part of the body's mechanisms, the inflammation that attracts healing substances, macrophages and stuff to the area. But and this kind of low grade elevation is correlated with heart disease. And then the last test that we do, it's not offered as an at-home kit test yet, so you have to go to the lab to do it, but it's fasting insulin. And I really think of all the tests, that's the very best one, except that you have to go to a lab, because elevated insulin levels precede elevated glucose levels, so it's the earliest warning sign of disease. And, so it can be, Dr. Kraft felt that, he made a couple of statements. One statement he said is there's no case of coronary artery disease that's not due to elevated insulin. He really felt that strongly. But he also felt that insulin could be elevated for up to a decade before your sugars start to creep up, which is really scary how we're actually seeing prediabetes and diabetes in like 5-year-olds now, because they don't even get a decade of life yet. Their sugars are just that high. So fasting insulin is kind of the last one, and that's sort of the holy grail, I think, of screening for chronic disease. If you get your fasting insulin levels really low, your likelihood of longevity is very high and having a great health span.
Yeah, I've been told and read that like 5.5 and lower is like really, really, is that good? Yeah.
Mm-hmm.
Okay.
I shoot for 2 and lower, but yeah.
Mine's 5.4, so I'm good to go.
That's good.
Yeah.
But and it's good to track these things. It's really, it's just like, we know, Greg's genius with coming up with, benchmark workouts is you can really do something that's measurable and repeatable. And that's the same idea with screening tests, because you can say, oh, I'm doing great, I'm eating well, blah, blah, blah. And then and you're like, hey, maybe I'm not doing it, maybe I need to tighten up the program a little bit. And similarly, if you have anyone of the benchmarks and you think you're doing great and you go back and your time's like 30% longer than it used to be, you can realize that, maybe maybe you haven't been getting to the gym.
I feel like you're talking about my fitness these days.
Absolutely not.
It's going in the wrong direction.
As soon as I hit one workout RX, I'll be happy.
Do you want to like make a comment on the things out? So that's with the Warrior Clinic.
Yep.
But then some other markers that are like the blood pressure and.
Right. So other things. So one of the biggest indicators for, bad outcomes is a thing called metabolic syndrome.
Mm-hmm.
And the diagnosis of metabolic syndrome is based on if you have 3 out of 5 abnormalities. One of them is an elevated glucose, which the hemoglobin A1C screens for as well. One is low HDL, high triglycerides, and then the other 2 things are an elevated blood pressure and abdominal circumference.
So which one of those is the addition to the deadly quartet?
Right.
Probably the blood pressure, but I forget. It's been a while since I read that article. So they put additional one in there. But if you don't know what the deadly quartet is, go read it. We won't. It's an amazing article. Yeah. And so it's really simple, actually. Again, not being physicians, but I think that preventative healthcare needs to be taken out of the medical space and into places like the box where a trainer can say, you're not saying, hey, I'm making a diagnosis, you have this, you need to be on this med, et cetera, et cetera. But it's very easy to get a measuring tape to measure abdominal girth when people come in, and to get a blood pressure cuff and measure people's blood pressure, and then have them screen either through their doctor or through something like the Warrior Clinic, which will give you the other 3. And then you can say, look, if you have 3 of these 5 things, you have metabolic syndrome, go home and read about it. And the solution to it is diet and exercise. And it's pretty simple to say, and you're not saying, hey, I'm a doctor, this is what you need to do. And certainly for anybody within the box, if they're already on medication for either lowering blood pressure or for lowering blood sugars, and you're going to make drastic changes to their diet and nutrition, the physician needs to be on board with what's happening, because they could, either bottom out their blood pressure or bottom out their sugars if they're not being tracked while they're making the changes.
But only because you're doing so well.
Yeah, and that is something I cannot stress enough. And people ask this; these questions do come up regularly at the level 1, more so than the level 2. But my general guidance is, if you are not a doctor, don't do doctor stuff, right? Like, that is not your swim lane. Don't do it. But again, going back to kind of what we were talking about earlier, is like, start to arm your clients because they don't know. So now that's our job to know. So inform them so that they can have an informed conversation with their doctor. So that is kind of the recommendation, is like, you're going to have that conversation with the physician, but you're going to have it through the patient. So we live on either side of that patient. So we have to have that conversation, because the physician, as you guys already stated, really doesn't have the time to do that. We do have the time.
Yeah.
We see them far more frequently than the doctor does. So we have the ability to make a much greater impact on their life. But we do have to not just train them, we do have to educate them. And I think that is kind of that gap that we have to bridge with regard to, okay, everybody's on board with constantly very functional movements, trained at high intensity is effective, but how do we start moving towards the health aspect of it, which means most of us need to brush up a little bit on some of this stuff, start pushing our athletes to have conversations with their physicians, start maybe recommending people get more frequent blood draws and panels from the Warrior Clinic or wherever they can, if they can get it from their physicians, so that they can start operating with all the things that we already do in the gym, which is observable, measurable, repeatable metrics. Because again, they can't lie about that stuff. Like, if the blood panel comes back and it's a disaster, like, that's a really easy conversation.
Yeah, so if your triglycerides are 400, then you have an idea that you probably need to make some changes, right?
And the quartet is HDL. It doesn't have HDL.
Yep.
Yeah, but I do think that it's I guess it's a fine line between practicing medicine versus. I think it's completely within the scope of practice of a gym to, just like you put somebody on a scale, and if you use one of those ones that you get body fat percentages, and stuff, that all of these tests are very motivating for people just like, hey, I can do a push-up now, I can do a pull-up. I mean, that keeps people coming back.
Mm-hmm.
But when you actually see changes in your body composition, or you see changes in your metabolic markers, you can really feel that you are in control of your destiny. You know what I mean?
Yeah.
And in the current system, you have to going to the doctor sucks. I mean, it's, I'm so busy.
Mm-hmm.
It's hard to find the time, right? I mean, it's hard to get appointments. It's hard to find the time. You don't have enough time when you get there. I mean, it's difficult. So the more that people can be empowered to do on their own, the better off they're likely to be. And that's not to say if your arm's in 3 pieces, you want to look up on the internet what to do. I mean, there's times, it's the Greg's old lifeguard swim coach.
Yeah, stay off PubMed. Just you get lost in there. But where's the best place to find what you guys are doing? Is it the Warrior Clinic?
Yeah.
For us, yeah, it's the Warrior Clinic. And we have we're pretty reachable just at the email at the info@thewarriorclinic.com if people, have questions or anything.
Do you guys have any social media handles, any like Instagram or anything like that?
We do, but we're just starting it. So the Warrior Clinic, but thank you for that. But we're just starting it. But it's really, and there's a lot of information too on the tests too, if they want to know about it, on the website. And then at the Warrior Clinic. But there's not as much information on that, but we're doing it.
We're just going to push people there and force you guys to have to grow that.
To give information.
Yeah, there's a lot of good reading there for people to, get a little bit of information just on,
on the website.
Again, we're not a nutritionist or a dietitian. And so, we'll guide people to, somebody or for if they need more specific work, but we give some basic discussions on what you should avoid and what is good. And similarly with, exercise, I mean, if people are going to CrossFit, they kind of have it already, but we're big believers in resistance training and high intensity interval type of training, it's the constant, very, high intensity functional movements. It's better than anything in my opinion.
The work's being done in the box.
Yeah. When did have you guys both taken the level 1?
Yeah. Mike G was our flow master.
Yeah, we had
nice.
Mike G, then we had EC, and we had Mo, and we had Ray. And we had Matt Loden. So we had an amazing crew.
That's a good crew. How long ago was that?
2.5 years.
Okay.
Really?
Yeah.
I was going to be like 5 years. It feels like forever.
Yeah, because then we'd be expiring.
Yeah. Then you'd have to re-up. And I have to ask, did you pass the test? Are you guys level 1?
Yes, absolutely.
Okay. All right,
so we get home and, I'm always in like everything I've done, like my boards, everything. I'm like 99 percentile, right? Like I am like, so like as I was like that med student that wanted to get an A+ even though they didn't have grades. And so we get home and I'm like struggling through this test because I've never not written on a test. Like I cross things off and they're like, do not write on the test. I'm like, wow, like how am I going to do this? And then we don't have a desk. So I'm like sitting there trying to like visualize everything. And we get in the car and I'm like, wow, babe, that was hard. That was really hard. I'm making excuses just because it was hard.
Yeah.
And Scott's like, that was easy. That was so easy. So for the next 24 hours, I hear about how he's pretty sure. I'm like, babe, we didn't get results back. You know that you just get a pass for no. So nobody knows that you actually did better than me. You just think you did.
Yep.
So he's like 100% certain that like I got like 1 point passing and he got like 100%. He got 100%, right?
I think I did better than you.
I like that level of confidence. I can appreciate that. It's good. No, it is funny.
He's 100% too. He knows he's better.
I have seen some medical professionals leave there in full sweat. I don't think I passed on it. I'm like, you've done far more difficult things than take the level 1 test. So.
No, that test is so hard because they also put the wrong answer, the right answer from other questions to the wrong answer from so is in our boards, they don't do that. They just the right answer. As soon as you see the right answer, you go on to the next question. It was probably about halfway through the test and I'm like, there's some right answers to other questions. Mm-hmm. You actually have to read the whole question.
How about that, right? Now, it could have been some of those test questions in there, right? The ones that don't count against you, but I always like to ask.
I got those right too.
Yeah, sometimes I do watch people take the test, and I'm just kind of like, I don't know about that. It's always funny to watch people kind of their thought process when they do it. But cool. This has been amazing. I could do this literally for the rest of the night because I love to nerd out on this stuff. But thank you guys so much for this. I think I think people will have to listen to this podcast 2, 3, maybe 4 times to pull a lot of this information out of it. But this is incredibly valuable information and incredibly important for the community, because a lot of us, not only do we have to just shift our focus, but we kind of have to shift where we spend some of our mental resources in order to do that, right? It's not just train the air squat anymore. It's like, hey, if we're going to actually combat chronic disease, we have to continue to be better trainers, but we also have to get smarter and figure out what the good resources are. And you two are both helping the community do that. So thank you for that. And thank you guys for your time. I really appreciate it.
Thank you so much for having us. And, I really hope that the affiliates, Greg's a genius. And I think he's seen, where this can go so much further than anybody else. But I really think that so much more value can be added to what is offered inside of the box by getting people healthy in addition to getting them, jacked.
Yeah. And I think this conversation is how that starts. I have a vision of my gym in 10 years where that is like where you go for everything. Like we have a nutritionist, we have a doctor, we have a trainer, like all the 3 things that you would ever need to basically live until you're 200 years old. So
that's amazing. And we're really grateful for the affiliates. As doctors, we're beyond grateful for the work that they're doing to make all that difference, because they're the ones who are making the difference. And
that just gives me chills, because it just is so, as a physician and you struggle with what's going on, it's just so freeing to know that there's a solution.
Yeah. It's we just got to keep pushing. It's just one person at a time. So just like one rep at a time in a workout. So thank you guys very much. This has been amazing. So I appreciate it.
Thank you so much.
Improving your life or achieving your goals can sometimes feel like climbing a mountain. On the Tiny Leaps, Big Changes podcast, host Greg Clunas gives practical tips and advice to help you build momentum towards accomplishing the seemingly impossible. Each episode provides research-based strategies or firsthand experiences on topics like mental health, fitness, nutrition, finances, career, and relationships. You can listen to the Tiny Leaps, Big Changes podcast on Spotify or wherever else you listen to your favorite podcast. Thanks for listening to Best Hour of Their Day. If you haven't heard about Anchor, it's the easiest way to make a podcast. Let me explain. First of all, it's free. How cool is that? There's a creation tool that allows you to record and edit your podcast right from your phone or computer, so it becomes super simple. Some of these episodes with Fern or Todd or myself chatting with one another, we've done right within the app itself. Anchor will make it easy to distribute your podcast to all platforms, Spotify, Apple, and many more. And you can make money from your podcast with no minimum listenership. It's everything you need to make an awesome podcast in one place. All you have to do is download the free Anchor app or go to anchor.fm to get started today. Thanks again for listening to Best Hour of Their Day. We hope you enjoyed this episode. And if you did, one more time, please leave us a review on Apple Podcast and send us any feedback you have to @besthouroftheirday on Instagram and besthouroftheirday@gmail.com if you want to shoot us an email. We appreciate you. Thanks again. Have a great rest of your day.